This week on Outside Eye, an incorrect statistic grabs international headlines. But the issue of unprotected teenage sex is not just a South African dilemma. It's a massive problem in the US, Europe and South America. Here at home, sugar daddies are being blamed for infecting girls as young as 10 with HIV. And experts are looking to Kenya for answers. That's the burning issue this week on Outside Eye, your global perspective on South Africa in 15 minutes.
Crossed the Red Sea and we are on our way to the promised land. All of us, black and white together.
Last month, the Minister of Health was incorrectly quoted as having said more than a quarter of schoolgirls in South Africa are HIV positive. The story was picked up by journalists from around the world. The mistake was quickly corrected, but it's going to take a lot longer to rectify the scourge of teenage sex and HIV prevalence among young schoolgirls in South Africa. First, we look at why it's happening here, and then we go around the world for a global picture. So you guys are 16, 17. Are a lot of girls in your class, in your age group, having sex?
Yes, and they say it makes them forget stress or things that they should be worrying about.
It de-stresses them?
Yes, and some of them say it makes their partners love them more than before having sex with them.
And are you guys having sex?
No.
How come?
We're not ready. And we think we won't be ready for the consequences of sex, like pregnancy and disease.
How many girls do you know who've had sex?
Plenty of them.
In our school last year, there were 74 pregnant children.
And what do they say? I mean, how are they going to raise the children? Do they think about that?
No, they don't. They even feel proud. And they even say to us, Libana Luna, you know nothing.
Yeah, they don't have sex with the boys which are the same age with them, because they'll say
and they say, I need someone with experience to teach me. Some of them don't even come to school when they go to sleep with their boyfriends. They walk home wearing a uniform, and then they go to their boyfriends' houses, and then
during school hours.
Yeah, and then
instead of coming to school.
Yeah, and then when they see us going home, they'll walk out like they've been to school.
But they've spent the whole day having sex with their boyfriends.
Yeah.
Older men mostly.
Most of them are men. They're not teenagers, because teenagers don't have the rooms that will stay with them inside.
And most adults will say, today the weather is good, you should come to my house, I'll buy you this, I'll buy you that.
The morals have gone down, if I might put it that way. There is no communication between parents and children. And the parents are saying that their children knows more than what they can be able to share with them. The children are actually ahead with information, while the parents think that there's nothing that I can tell my child because I don't know anything. And in a study which has been conducted by the Department of Education, it was clearly indicated that young people need to hear information about sex and sexuality from their own parents or a caregiver or a guardian, because there is not much information that is being shared with the children, especially on the media that they are looking at. There is not much key messages that they get on prevention of sexual transmitted infections or HIV and AIDS on TV.
According to the Centers for Disease Control, in the United States, nearly 1 in 5 births to teen mothers is a repeat birth. Some teenagers are having up to 4 to 6 children. And in 2010, Latin America was declared the one region in the world that has seen a consistent rise in teenage pregnancies since 1980. And just last year, in a study published in the Lancet Medical Journal, it was revealed that Denmark has the highest proportion of sexually active teenagers in the world. The difference between them and us is that HIV prevalence here is much higher.
In South Africa, young people actually engage in less risky behavior than their American counterparts. And there was a very nice article last year that summarized or compared these two and tried to explain why it is that even though South African youth engage in less risky behavior, they have more HIV. And many factors, including the fact that there is much more HIV in the population, but there are other factors.
In Denmark, we don't have this sugar daddy phenomenon. That's not why girls have sex early. I think it's because they just feel like trying it. You have to go more than 40 years back, because in the end of the 60s, in '69, pornography was legalized in Denmark. It was the first country in the world who did that. And so everybody has grown up with pornography everywhere, kind of. And I think that has influenced the young people in Denmark.
In Latin America, the Inter-American Development Bank released this video after conducting a study on teenage pregnancies in 2011.
These are women who generally have very low academic performance, and they have little or no expectations to not repeat the socioeconomically disenfranchised lives of their parents. The pregnancy to them is a way of becoming adults, it's a way of giving meaning to their lives, and it's a convenient excuse many times to drop out of the school system.
72% of the young people don't use condoms. And that means diseases like chlamydia is on the rise. And I think the difference from South Africa and Denmark is we don't really have a problem with HIV only among gays, mostly. Yeah? So the young people don't fear to get HIV in Denmark.
Youth only represent a much smaller percentage of the epidemic in the US. And the populations affected are also very different. The populations in the US affected mainly are men who have sex with men, especially among youth, while in South Africa, young women are clearly much more at risk.
If the pregnancies are actually to some extent planned, then the policy responses have to go beyond simply providing access to and information about birth control. We need school-based interventions. We need to provide quality education, assistance to students who lag behind, and mentoring to students so that they can develop life plans and aspirations that go beyond simply repeating the socioeconomically disenfranchised lives of their parents. And for students who become pregnant, we need to help them remain in school and return to school after childbirth.
When we return, South Africa looks to Kenya for solutions.
News that moves. ENCA.com.